Good day, and welcome to the fourth of a series of presentations on particular cases of patients who underwent a screening MCG test and the effects that accurate, early detection had upon their lives. The purpose of this video is twofold. First, as said previously, demonstrating the machine learning algorithm's methodology of obtaining diagnosis, and secondly, training and onboarding physicians to better understand how best to use MCG for a patient presented without any symptoms and wanting to use MCG as a screening tool to monitor his lifestyle changes. We can learn from real-world examples how to use MCG to initially detect and then monitor the improvement of a patient's ischemia after significant lifestyle changes and weight loss. By doing this, patients can avoid relying on conventional diagnostic tools such as EKG, troponin testing, stress imaging tests, and angiograms to avoid the time and monetary costs of going through testing that usually fails to provide adequate early detection. The most important takeaways I'd like you all to consider today are 1. The patterns presented in the 3 consecutive test sessions performed over 18 months led to an initial diagnosis of functional ischemia due to early-stage metabolic heart disease, placing this patient in category D on a scale which rates alphabetically from A to H. If untreated, his metabolic heart disease, missed by all of the conventional tools, may eventually progress into non-obstructive CAD. This kind of quantitative early detection is only possible using MCG technology. 2. The reversal of his initial findings, mainly his metabolic heart disease, following a simple lifestyle improvement program, including stress reduction, a weight loss program, and without the usual cost and time required to visit a cardiologist, undergo stress imaging testing, taking any medications, or submitting to risky coronary interventions. Evidence proves that MCG can be an effective screening tool for early detection and for monitoring the disease reversal effects of primary prevention safely, without medication or intervention, at least in cases like this patient. The following story is an outline of this patient's journey. As a 42-year-old sales executive, he has an extensive travel history, living a stressful life and eating irregularly at best. While feeling tired and being overweight at the same time, he requested to be tested on MCG to see if our technology could detect any heart problems, as he had a substantial family history of heart disease. This slide covers the 3 test sessions' individual score counts. He was tested in 3 sessions, each happening 6 months apart from each other. The first MCG test session showed that he scored 3.5, 4.0, and a 0.0 on a disease functional severity scale that goes from 0 to 22 within the first 5 minutes. These scores, if left untreated, could progress to become a much more serious heart dysfunction, possibly leading to heart attacks in his early 50s. Thankfully, he initiated an excellent lifestyle improvement program that led to the reversal of his initial metabolic heart disease. His subsequent test sessions, recorded 6 months and then 1 year later respectively, showed a reproducible, consistent 0.0 on all of his follow-up tests. These gave him an excellent outlook and confidence for the future. If his subsequent yearly tests still show the same results, and if he keeps up with his currently much healthier lifestyle, in the following 10 years at least he will not have to worry about suffering from a heart attack. This slide splits his results into 2 categories. His first session rated a D in the 8-category system for moderate myocardial dysfunctions, largely due to early under-the-radar metabolic heart disease without obstructive coronary artery disease. He started a weight loss regimen, moved back to his home in Colorado, and started mountain bicycling every day for at least 45 minutes a day. The second session, 6 months later, showed a complete reversal of his initial metabolic heart dysfunctions with 4 zeros without any abnormal expressions whatsoever. His 1-year anniversary and the second follow-up testing session showed excellent reproducible results of 6 zeros for all of his tests. These trackable, measurable changes over a span of 18 months are extremely useful for clinical assessments on how to evaluate the immediate, intermediate, and long-term outcomes of preventative primary lifestyle treatments, and allows physicians and patients alike to make better decisions moving forward. These are graphical representations of the autopower spectrum measurements of both of this patient's sessions. We want to use this to demonstrate the MCG Analysis program understanding the unique expressions of the cardiovascular system by breaking down electrical signals of the heart into frequency bands that can be viewed and measured as such. From here, the analysis engine measures the peaks, trows, interpeaks, intervals, and overall power output, represented by the area under the curve, from all expressible and readable peaks within the frequency spectra. The machine's ability to perform these measurements and pattern recognition algorithms automatically without the need for expert intervention or extra human labor for data analysis means that it is capable of performing its work 24/7, anywhere in the world with an internet connection, so long as the initial tracing submitted to the system is of good quality. This computer-based objectivity is crucial for accurate, reproducible, and reliable diagnosis, and assists doctors around the world in making critical decisions for their patients' short and long-term futures much faster than they would with other tools. For his phase angle shift visualization, the expressions shown both are quite abnormal for his initial testing. Thankfully, his post-treatment analysis shows normal expressions in the sessions conducted both 6 months and 1 year later. This function, impulse response, is useful for looking at the response of the system to internal or external stimulus. It can be used to measure myocardial compliance. When it's increased, this may mean that there is acute myocardial damage or myocarditis to ischemia. When it's reported as decreased, it could be myocardial hypertrophy or increased stiffness of the myocardium due to hypertensive heart disease, just as a few examples. Not to mention the various arrhythmias that can also be evaluated using this function. We discovered that mathematical elements like these are vital to the quantitative assessment of a patient's overall functional status, or what we call the disease severity score. Cross-correlation, meanwhile, provides many very useful measurements, focusing visually on the results generated and shown in the graph. Where the first session showed abnormal measurements, the treatment he underwent showed a return to a more normal pattern that is also settled but reproducible. In a way, the treatment brought normality back to his cardiovascular system that can be seen mathematically in ways that no other diagnostic solution can provide. We believe that his tiredness was a metabolically induced supply and demand imbalance, and by tracking the changes in the expressions of his cardiovascular system, we were able to reverse them and accurately measure the effectiveness of the treatment over long periods of time. The transfer function, meanwhile, can serve as the bridge to move from one functional environment to another. The differences between the pre- and post-treatment measurements are, again, quite visible to the naked eye. These colored heat maps of the multiple functions are very useful not only for the visualization of the mathematical output, but also providing gateways to better machine learning color matrices for pattern recognition and disease severity calculations and early warning of sudden cardiac death. And finally, these mathematical structural element matrices collect the results of the functions described previously to create these patterns in a transparent and reproducible manner. The MCG proprietary neural network and its associated machine learning algorithms then uses these mathematical structural elements as the basis for the neurons to build the network for pattern recognition. It has taken us more than a decade to build and years to perfect, but all of that hard work paid off and allowed us to save the life of the man we have spent this time discussing, and other men and women like him. While tools like regular exercise, better diet, and decreased stress might seem less intensive and dramatic compared to interventional surgery, prescribed medications, and other such methods, we believe in the adage that an ounce of prevention is worth a pound of cure. Catching these problems as early as possible and putting the patient on the right course to correct them is critical for dethroning cardiovascular disease as the premier killer of mankind. Costly hospital and clinical visits for unnecessary testing, medications, interventions, side effects from the drugs, and other stresses put onto the kidney and other organs due to things like IV contrasts can be avoided for patients around the world, saving lives and dramatically lowering costs by the hundreds of billions for all. I hope this presentation has proved useful in better understanding some of how our system performs its diagnosis to save lives and cut costs for patients and doctors alike. If you have any questions, feel free to visit our website or send an email to info@premierheart.com and have a wonderful day. Thank you for your time.